Hi everyone, my name's Gordon Sears, and today I'm going to be talking to you about Comics for Kids, which is my personal innovation pitch. My story started off in a hotel room in Philadelphia in 2002, where my brother had his first febrile seizure. This comic strip depicts some of the events that took place over the next few months and over the next few years. My family was scared, I was scared, and we got very little answers in the emergency room. And years later, my brother would cope with this disorder by playing Legos or doing other activities with me. But I would always have to make sure that he had a pillow or a soft object near him in case he had a seizure so he wouldn't hurt himself. My brother had seizures in the car wash, which was very scary, and would have seizures pretty much anywhere, so we had to be very careful at all times. The stress in a situation like this is often overlooked by clinicians. My problem statement is that I want to change the standard of care in pediatric neurology and psychiatry because I've experienced caring for pediatric patients suffering from neurological and psychiatric disorders. My brother himself suffered from chronic seizures when he was young. I want to provide better care to these patients and change the one-size-fits-all mentality that my family and I have experienced and that I have seen at my job within this field. My story may have started in Philadelphia, but this was not an isolated experience. 1 in 6 children ages 2 to 8 have a behavioral or developmental disorder, and as many as 20% of children ages 6 to 11 have depression or anxiety, or a behavioral disorder. These disorders often parallel neurological disorders. So what's the solution to caring for these patients? Enter narrative medicine via comic strips. Narrative medicine uses storytelling to better connect with and provide information to parents and their families. Based on the feedback we've got from providers, parents, teachers, and former patients, the stigma of pediatric illness and the fear and uncertainty of the child's condition are most likely to affect the patient outcomes. For these reasons, it was necessary to think outside the box and transition to something that kids can relate to. Enter comic strips and enter the rediscovery of my passion for artwork. Our users included teachers, doctors, family, friends, and clinicians, and our user feedback has resulted in this standard prototype, which can be altered for different illnesses, or to treat and address different children's interests, reading level, or any variable that will help connect better for the patient and their family. We ask and encourage all who provide support to pediatric patients and provide support to children outside of the hospital to consider narrative medicine and the use of comics. Our users and our team members who work with children and have had children with neurological diseases have embraced this product and have been involved in every step of developmental feedback. Comics such as this one here, which is titled Jimmy's Strange New Feelings, are able to target a certain disorder. For example, Jimmy is having some depressive symptoms in this comic. He's playing football with one of his best friends, and it's a long weekend, but he's just not feeling happy. He goes to his birthday party, and again, he just doesn't feel happy. He's feeling pretty down on himself. And then eventually he has a talk with his parents, and they bring him to his primary care physician, who recommends that he get some treatment. And the primary care physician in this panel on the right here is basically making the family feel safe, making them feel comfortable, and explaining what's going on to kind of break this stigma and provide better care, because that one-size-fits-all model that I mentioned earlier is just not effective. And as I said, this is meant to be adapted to different illnesses and different children's interests. For example, if a child likes to play the piano, maybe the piano could be incorporated in such a way. If a child likes to sing, play the guitar, or draw, drawing could be incorporated in such a way. And the reading level can be changed as well, or the comic can be read by a parent to the child while they're in the hospital or while they're in the doctor's office. In this way, we can better relate to the children, get a better diagnosis, and help the family feel better about the care that their child is receiving. As we see here with me and my brother, kids are playful, happy, creative, and ambitious. We need to incorporate comics for kids and think outside the box to give kids the treatment they need and deserve. The one-size-fits-all model just doesn't work with kids. This is a pretty interesting picture here. Not sure what me and my brother were doing, but it just shows that we were being creative. I think my brother's wearing Harry Potter glasses, so we must have been playing Harry Potter. We need to take this creativity and channel it into good. So let's make pediatrics fun, one comic at a time.